Hi, I'm Freya. I'm a student ambassador at the University of Derby, and I'll be asking the questions today. So I'm just going to pass the questions on to the panel. So I was wondering if you could introduce yourself and sum up your role in one sentence.
My name's Nikita. I'm one of the community podiatrists in Derby City. As a podiatrist, we manage complications of the lower limb and manage and treat specifically the foot.
My name's Victoria and I'm a community specialist podiatrist in the High Peak and Dales, and my role is quite similar to Nikita's.
So would you be able to maybe sum up your roles as well? I know you both do the same job, but would you be able to sum up your roles?
Yeah, absolutely. So we treat a diverse range of patients, really. We see patients of all ages, and we basically look into their foot problems, which could be things such as ingrown toenails, callus, corns, helping with the treatment and prevention of those. Sometimes we look at nail surgery. We also work with very high-risk patients with complex wounds. Normally the patient has diabetes, and sometimes that's sort of preventing amputation and treating and managing ulcers to hopefully prevent that amputation.
Like Nikita said, podiatry is a lot more complex than people initially believe. We care for such a wide range of patients, so we could have children with ingrown toenails, could be young adults, could be the elderly. So we treat so many different people. People sometimes think, oh, you must just be dealing with old people, but it's not like that at all. And whoever we're treating, it's really great to see such a wide range of people. Sometimes it could be plantar fasciitis, so they could have heel pain that won't go away, and we could really help them feel better. And sometimes just getting rid of that pain, people go, oh, you know, I've felt terrible for months, and now suddenly I feel like I can walk again, which is so rewarding for us. So it's really important that we do deal with the basics properly, you know, do the basics well, because some things like long nails or corns, they could lead to foot ulcers, wounds if not treated properly. And like Nikita said, we're actually in a lot of cases trying to prevent these from becoming infected. We're trying to prevent them from progressing to bigger wounds and then amputations, and ultimately these things could cost people their lives. So we're trying to save lives and limbs.
Yeah, I mean, it sounds really interesting. As someone who doesn't know much about the role, that really helps. So you both work as community podiatrists. Are there any roles or settings that you might work in?
Absolutely, yes. There's a wide range of settings that we work in. Most of our time is spent at healthcare centres, but it's never the same one every day. We move around quite a lot of the time. Also, sometimes we can work at the hospital, and that's normally with the foot clinic department. So we work alongside consultants and surgeons there. Another sort of setting we work at, sort of in patients' homes. We may treat them there if they cannot leave their home. Also nursing homes, and in some cases as well with some podiatrists, they can work sort of privately, but also in prisons and things like that as well. I'm not sure if Victoria has any other settings we work in. I might have missed a couple.
So another part of podiatry that isn't very well known about unless you are a podiatrist is podiatric surgery. And often the MDTs, the multidisciplinary teams at the hospitals, the foot clinics that Nikita was talking about, they often have a podiatric surgeon attached to them as well. And that's a podiatrist who's actually gone down the surgical route. So I think it's one of the only things you can do where you can go from, instead of doing normal kind of doctor training, you become a podiatrist and you work your way up to being a podiatric surgeon, which is a really interesting career progression.
Yeah, it's interesting to see kind of the wide range and of settings, because a lot that I don't know about. So I guess so. Are there any kind of settings or what other So what would be the first steps for someone watching the event that one might be considering this as a career? Now, you said all about these settings.
I would say if anyone is interested in podiatry, then absolutely follow it and try and get some shadowing somewhere. Normally in most NHS trusts, we do offer shadowing opportunities, even if it's just for a day, and just to see if you really like it and enjoy it. And then if you do, then explore into some of the university courses out there and look into those. Absolutely.
Yes, exactly that. Sometimes, particularly at the moment with COVID, it can be a little bit more difficult to find shadowing experiences, but that's opening up a lot more now. So just get in touch with somebody local, even if go to your local podiatry clinic and send a letter or an email, and you'll get a response. And I think that's a really good first step, just to see what we actually do, because just seeing what we do written down doesn't really show you what we do at all.
Yeah, so it's nice to hear kind of the different ways that you can kind of get some help there. So what personal qualities do you think you need to be a podiatrist?
I think the main thing is good or great communication skills. It is something, though, that you do develop on and you become better at when you're in certain situations and when you are working. But absolutely, I would say you'd like to have good communication skills and like to talk. And also with regards to qualities, I would say a passion for the job is vital, really, because a patient knows when you don't quite care or you're not quite interested. So you've got to have a passion for the job and enjoy what you're doing, really, and therefore you'll enjoy your job better, and also a better quality of care for the patients as well. And I would also say sort of being quite flexible and is also a good quality to have as well. And I'll let Victoria carry that on.
As always, I agree with everything you're saying, Nikita. It's really important as well that as well as communicating well with the patients, a lot of that is the listening aspect of things, because sometimes patients can tell you lots of different things and you have to pick out the things that are relevant, work out which are red herrings and which are red flags. So you need to be able to think outside the box. We learn a lot about different medical conditions, a lot about the anatomy, and it's the ability to tie those things together. Which is really interesting. It's great when you put your finger on something and go, okay, that's why this problem is happening. So being analytical is really important. It's also really important to be good with your hands. We do a lot of fine work with, scalpels and with nail nippers and making different types of padding. So it's just really important that you like doing that, because that's what we do a lot of.
Yeah, so that sounds really interesting, mentioning all the different qualities from being really practical. Just sounds really interesting, things that I probably would never have thought of as well. So what would be a typical day? Don't be afraid to say if it's boring, go into lots of detail. I'm sure people will be very interested in it.
So personally, I work Monday to Friday, 9 till 5 really. So with that, there is other flexibilities as well. Some people might work part-time or different hours, but sort of Monday to Friday I am in a different place each day, and a different type of clinic as well. So it might be that I'm just seeing nail surgery patients, or I might be doing their assessments to see whether we can offer the nail surgery here. Sometimes if the patient is really high risk, then we may refer them to hospital for the procedure instead. So it's doing that assessment initially before we do the nail surgery. And then what we'll do normally is a nail surgery session is in the morning, and we perhaps see about 4 patients. And with that, we sort of use local anaesthetic and we inject that into the toe. And then we do the nail surgery procedure and give all the aftercare and see them a couple of days after as well. So I could be doing that on a Monday. And then on a Tuesday, I could be at a high risk clinic, and that's sort of seeing patients with diabetes or rheumatoid arthritis or other conditions that may cause deformities or basically make them at high risk of developing problems with their feet. So it's sort of preventing breakdown and preventing ulceration. So with those, I'll be removing hard skin, perhaps looking at their footwear. We might need to refer them to an orthotist who makes sort of bespoke footwear for that patient. We also look at sort of chairside orthotics, so perhaps making something with foam or felt to try and distribute the pressure away from certain aspects that may be building up with high amounts of hard skin. That can normally be a problem area. So that could be another day. And on a Wednesday, I could be at foot clinic. Again, as I say, sort of with the consultants and working alongside them. It is very different there, because with your own clinic, you sort of see the patient and you do the referrals and everything, and then you send them home. And then we see them again, perhaps every between sometimes 2 and 12 weeks, depending on their risk. And then also at the foot clinic, it's a bit different, because you are waiting for the consultant to come, and the consultant will go through everything with the patient as well. So it's quite nice there to work alongside them. You're definitely working as a team there, whereas sort of in your own clinics, it is a little bit more sort of lone working, even though there's people around and there's people to sort of get a second opinion from. It is very different from the foot clinic environment, as you are working as a big multidisciplinary team there. But yes, I'll let Victoria carry on.
I'm not sure there's anything else for me to say, Nikita. I'd say the only extra thing I'd add in is that, so a lot of the time I have clinics in a health centre, in a community hospital in the morning, and then often in the afternoons I'll be out on home visits. So I'll be going to people who are housebound or bedbound, and treating them there, and that's really rewarding. Lots of these people don't really get to see many people in a day, or they're constantly seeing lots of carers, but people generally know when their feet need attending to, and they're just really grateful when you've been to see them.
It all sounds really interesting, like summing up your day and kind of what activities you get up to for some people that may not really understand what exactly podiatry is. So I suppose the next question is kind of, what different ways are there to study?
Yeah, so recently they've started some apprenticeships in some areas, which I think is a brilliant thing, because you can get hands-on and work alongside us within your first within the first year as well. So I think it's a great way of learning, to be honest. And the other way really is sort of through university, either a full-time course or a part-time course. Normally the full-time is 3 years, and the part-time is about 4.5 years, depending on the university and how they sort of set up their courses really, and how they deliver them. And also, I do just need to mention as well, I didn't mention before, just about sort of musculoskeletal podiatry. Even though it's something I don't do in my normal week, it is a huge part of podiatry, and a way to look at it is sort of like physiotherapy for the lower limb. So just sort of any patient pain sort of with regards to muscles, tendons and things like that. We do a full assessment, sometimes providing the insoles and sometimes steroid injections as well. So it's sort of sports injuries and things like that, and preventing those. I thought I'd just mention that, as it's something that a lot of podiatrists do specialise in and really have a passion for, and it's a pathway with podiatry.
The only other thing I'd include about the different ways to study, I know that some universities now also offering a foundation year. So if that was just a different way that people wanted to access the course, I think it's fantastic. It just opens it up to more people, and there are fewer barriers then to studying podiatry.
It's great to hear about the different routes you can get into a career as well, just to hear the different ways you might progress into your profession. So kind of linking on to that, what opportunities are there for progression within the career itself?
It all depends with the trust you're with. I would say with our trust here, there is a lot of opportunities to progress. And also, when you're ready as well, whereas a lot of perhaps different trusts might not have the opportunity to progress or perhaps go up a band, which is sort of the way that you get paid and the pay scale, and to go up a band, obviously there needs to be an opportunity there, and I think there is always a lot of opportunities here for us. But yes, I would definitely say there's a lot of ways to progress in this trust.
Yep, agreed. We're constantly getting different job opportunities offered to us. They come through our NHS email, you know, for different progression opportunities within the trust. And if people want to progress, there are really very few barriers to doing so.
So a bit of a strange question, but one people might be interested in is, so some people think feet aren't very nice. So does that come with time that you like feet, or does it kind of come with the career as a pathway?
Yes, great question actually, because when I was at school, I didn't know about podiatry, and if anyone mentioned that I would be working with feet when I was older, I would say absolutely not. But I am, and they don't bother me now. I think the huge thing is when you're in school, a lot of the time you sort of follow your friends or peers, and if someone says, oh, I don't like feet, I think we then sort of say, oh, I don't either. And really, if you do really hate feet, then obviously don't choose podiatry. But no, otherwise, you know, if they don't bother you, and as I say, if you come and shadow us and have a look and see what we do, and you feel fine about it, and then I would say go ahead and do it. But yeah, I don't know if Victoria wants to add to that at all.
Well, exactly. I think the whole peer-related footphobia is an interesting one, but I've never had a problem with anything. I've always had a very strong stomach, and I'm not phased. So I think it was a very natural choice for me. But they're just like your hands, except you get to be a little bit further away from people. It's actually a very nice distance to be at when you're talking to somebody, like 1.5 meters away. It's quite a nice place to be. And actually, people think, oh, feet must be really smelly. For the most part, people are so concerned that their feet might be smelly and more likely to find bubble bath between their toes than anything else. I think the biggest thing that you might have to deal with if you're concerned about things being a bit gory is the wound care, because it can be interesting. And if you can handle wounds and you're not fussed by feet, then it's the perfect job for you.
Yeah, so thank you for kind of summing up that slightly strange question, but it was great to hear all the information on that. So what advice would you give to anyone considering this career in the future?
I would say come and join us. We need a lot more podiatrists. I would say we're struggling really with regards to sort of graduate levels and things like that, and staff levels as well. Obviously, it's not always a career that a lot of people know about, or it might not be everyone's cup of tea, which is absolutely fine. But I think really it's just that exposure, and if people are told about podiatry, then at least they can consider it. And if you are considering it, then yeah, please join us.
Yeah, absolutely. Podiatry wasn't something that I thought about when I was in school, and I wish I had, because it's really opened a lot of doors. And I only found out about podiatry and considered doing it sort of by accident when I was looking at other courses. So I'm just really glad that I kind of fell into a talk at an open day and found out a bit more about it, because honestly, it was not what I was planning to do at all. I'm really glad that I did. I just also think you need a sense of humour and an open mind, and you'll be fine.
Yeah, so thank you for kind of summing up that experience as well and giving people advice. As you kind of said, you fell into it, and I hope this gives kind of more exposure to podiatry as well. So I just want to thank you for an interesting discussion today and talking to us about it. So yeah, just thank you for participating. in the event.